Hello, my name is Peter Walker-Birch with yet another video podcast for Clinical Placement 1. Now, I hope that you're all still enjoying your clinical placements and hopefully enjoying the recent spell of good weather that we seem to be having. Though I'm obliged to say that I'm struggling a little bit with all this heat. But then, what do you expect when I still wear my black jumpers when sunbathing and doing video podcasts? Now, many apologies again for the delay in getting this edition of the podcast out to you. It has taken quite a while to put the animation together for this particular episode, the Deal or No Deal quiz that will follow this short announcement. Not least because I'm currently on annual leave at the moment with my two children, Alexander, whom you've met, and my beautiful daughter Alice. Now, the Deal or No Deal request came from Phil Cosson whilst we were chatting over lunch a couple of weeks ago. Now, to be honest, I hadn't really seen the show, so I thought that I would take a look and see what I could do with it. And then it came to me, why not use the Deal or No Deal theme to look at justification of radiology requests, just as you will be expected to do during the tripartite examination. Now, as radiographers, it seems, at least to me, that we are always doing deals of some kind with the clinicians when it comes to justifying radiology requests, whether they have provided the right clinical information or requested the right examination to justify the patient's exposure to ionising radiation. Of course, what's really happening is that we are acting as advocates for the patient to ensure that no patient gets an unnecessary dose of ionising radiation. But for the purposes of this week's quiz, I thought that I would sort of stretch the reality somewhat to provide you with a more interesting way of justifying the radiology requests. Now, for those of you that haven't seen the Deal or No Deal programme, it is still running on the TV, but you can also Google old episodes. It's hosted by the great and seemingly ageless stalwart of tea time and weekend TV, Noel Edmonds. Now, my first encounter with Noel Edmonds was when he presented a live children's TV show back in the 70s and 80s called The Multicoloured Swap Shop, which I loved watching, though I was mortified when they formed the band Brown Sauce and released a single entitled I Wanna Be a Winner. Reached number 15. My word, number 15. Never mind, think yourselves lucky that you have excellent shows like Breaking Bad to entertain you instead. Now, I have to say, I found the real Deal or No Deal game really interesting and, dare I say it, exciting. I should try and watch some more of these episodes because I think they might help me to relax and unwind. Now, there are 26 boxes in this version of the game, just like the real game, each containing a radiology request from a referring clinician. Now, your job as radiographers is to determine whether the requests are justified, i.e. a deal, or not justified, i.e. no deal. More importantly, why are the requests justified or not justified? Now, the requests make use of some terminology that you may not yet be familiar. So please use this as a learning opportunity for you to more fully understand or more fully explore this terminology, as it may be an important factor in whether a request is justified or not. Now, just like the real Deal or No Deal, we have an unseen banker who makes a few phone calls with additional information or questions for you to answer. Now, does the additional information make any difference to the justification of the request? I'll leave that one up to you. Now, I shall post the answers for this quiz next week, at some point anyway. I will also post the answers at some point this week for the University Challenge quiz that I set you last week, and which I hope you enjoyed. Now, this is currently academic week number 2, and the task for this week, according to the module guide, is to start to practice articulating to yourself or a friend how you would carry out a particular X-ray examination. For example, an AP or lateral knee. Now, the idea is to make use of the correct radiographic positioning and projection terminology. You need to be able to discuss things like the angle and direction of the central ray, and the position of the patient, and affected body part with respect to gravity and the image receptor, the collimation required, the exposure factors you would use, any specific instructions given to the patient, etc., etc. Now you should start with justifying the request through setting up the room, through removing any risks to the patient, bringing the patient in, introducing yourself, explaining the exam, and then carrying out the X-ray for all relevant projections. Now, more guidance will be given to you during the revision session, which is going to be held in August. Now, you should now be a little more confident in using a system of image evaluation, such as DOGS, to evaluate an image in clinical practice. One of the tripartite questions is around the evaluation of an image, so please take the opportunity to practice this in the practice setting, or make use of the CD-ROM that was given to you at the start of the module to help you with this activity. Well, that's all from me for this week. I hope that you have another fantastic week in clinical practice. Remember, Mark Widderfield is now the on-call lecturer, so any urgent problems, just give Mark a call on the on-call number. Again, if you want to let me know how you are getting on in clinical practice, or you have ideas for a podcast, just drop me a line, an email or a tweet, as I do love hearing from you all. Anyway, enjoy the quiz, and I'll try and get another podcast out to you as soon as I can, possibly next week. So, good night for now. It was a good morning. Anyway, bye-bye. Deal or no deal? Deal or no deal? The banker reliably informs me that the clinician has forgotten to put the LMP of the patient on the request. The banker says that the LMP was 9 days ago. Is it a deal or no deal? Deal or no deal? Deal or no deal? Deal or no deal? Now again, the banker has reliably informed me that the referring clinician has now changed the request to a left and right sternoclavicular joint. Is the examination a deal or no deal? 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 Is it a deal or no deal? And while you're pondering that question, here's another one for you from the banker. What is the main radiographic feature of multiple myeloma? My word, the banker's busy this evening. So in addition to pondering whether this is a deal or no deal, the banker would also like you to consider the following question. Which of the following are eponymous fractures of the distal radius? Is it A, a Segond, B, a Smith's, C, a Jones, or D, a Montesia? Deal or no deal? My word, I think the banker must have swallowed a copy of Grey's Anatomy because he has another question for you. So in addition to deal or no deal, consider the following question. What nerve is commonly injured following shoulder dislocation? Is it A, the radial nerve, B, the axillary nerve, C, the long thoracic nerve, D, the phrenic nerve, or is it E, the musculocutaneous nerve? Over to you. My word, I think the banker's full of himself this evening. So in addition to deal or no deal, the banker would like you to consider the following question. Now, which of the following is most commonly used to identify metastatic disease when staging prostate cancer? Is it A, a CT chest, abdo and pelvis, B, a skeletal survey, C, a nuclear medicine bone scan, D, a whole body MRI, or is it E, a PET CT scan? Over to you. Deal or no deal? Deal or no deal? By Jove, I think the banker's having difficulty sleeping, just like me this evening. So again, another question. So in addition to deal or no deal, the banker would like you to consider the following question. What is the most common underlying cause of AAA? Is it A, infection? Is it B, trauma? C, atherosclerosis? D, connective tissue disease? Or is it E, vasculitis? Over to you. Deal or no deal? Deal or no deal? Deal or no deal? Okay, final question for the banker this evening. So in addition to deal or no deal, the banker would like you to consider the following question. Which of the following structures undergo volvulus? Is it A, the esophagus, B, the stomach, C, the duodenum, D, the cecum, or E, the sigmoid colon? Now this could be a trick question. Over to you.